And from that, we move on to another issue because the coronavirus global pandemic has spiked again across Africa, with highly contagious Delta variant spreading to more countries. At least 20 African countries are affected by the third wave, according to the African Centers for Disease Control and Prevention. Experts warn that the third wave is likely to be more devastating than the previous ones because the continent is lagging behind in the global vaccination drive. Details in this report.
The Africa Centers for Disease Control and Prevention is worried. It says it has reasons to believe that the third wave of the COVID-19 pandemic is seriously affecting more than 20 member states.
We are in the middle of a third wave. At least 20 countries are now fully and in the middle of their third wave across the continent, and it is very devastating. One thing we see is that the peak of the third wave is remarkably higher than the peak of when we had the second wave.
What is known as the third wave has shockingly stretched the health infrastructures of African states, with huge hospital bed shortages being reported. John Kengasong says the third wave is also worsening due to the Delta variant.
Within 6 weeks, that variant in DRC became a very, very predominant variant. And with that analysis is going on across several member states to understand what the situation is. And maybe, and just maybe, the variant in question is the Delta variant is perhaps playing a very significant role.
Africa still is banking on the prospects of vaccinating its citizens to permanently defeat the COVID-19 pandemic. But that plan is in jeopardy as the continent only vaccinated 1.1% of its population so far. The good news is Africa CDC is expecting hundreds of millions of doses of vaccines and has finished preparations to produce jobs within the continent.